And now for intraseptal anesthesia, also known as crestal anesthesia. I had this technique published in the first edition of my book on local anesthesia back in 1980. And interestingly enough, and whatever the reason, I never actually talked about this in my CE courses for maybe the next 35 years. It wasn't until this paper was published in 2011 that my interest in this technique was rekindled. And it is an intraosseous injection without drilling the hole. And in this study, they compared the success, pulpal anesthesia using electric pulp testers, of crestal anesthesia CA versus the inferior alveolar nerve block. And you can see from that chart that the first and second premolars had higher success rates in the inferior alveolar nerve block. But if you look at the first, second, and third molars, they had 100% success. So this is a technique that is simple to do and does have a high success rate. This is the chart from that article. And the onset of anesthesia, pulpal anesthesia using an electric pulp tester to determine it, was slower. It was about 3 minutes and 30 seconds versus 7 minutes. It was slower. But the duration of anesthesia was 23 minutes. 23 minutes is a decent working time. The volume of anesthetic used is tiny. It was 0.4 mils versus a full cartridge or more for the inferior alveolar nerve block. So using a smaller volume of anesthetic, it is a less painful injection, 1.5 out of 0 to 10, 1.5 versus 3.44. The duration was a little bit shorter than the IA block and the onset a little bit slower, but it had a very, very high success rate on premolars and 100% success on the 3 mandibular molars. And quite simply, you're going to be using a 27 gauge short needle. A little bit of topical anesthesia at the crest of the papilla. You take your needle and you simply insert it at a right angle to that crestal bone. The needle tip will get wedged into that bone, and you sit there and you administer 2 rubber stoppers worth of anesthetic. Take an electric pulp tester or endo ice on that tooth. When the patient no longer responds, you can then go to work. Very, very nice injection.
Well, welcome back. So 2011, an article in 2011. So things really are changing. There's still even more hope. We offer ourselves more hope. I thought that was great to learn about that intraseptal injection or anesthesia there. And you know what's interesting? If we're pulling all of our cool tools out of our tool belt and we're pulling them out with confidence, right? We've got all these different tools now. You know that we'll be less embarrassed when things go wrong. We won't be embarrassed at all, really. And we won't be frustrated because we're using the tools and we know how to use them. We'll be less confused because we'll understand when things aren't going well, why things aren't going well. And our confidence will actually go up. It'll go up quite a bit. And by the way, how will that make our patients feel? Everybody's going to feel a heck of a lot better, right? So now combine the learning from part 1 of this course on the mandibular nerve blocks with part 2, where we did the Vazirani achinosi, the PDL, the intraosseous, and the intraseptal. And we really do have hope. And we can offer ourselves some grace when it does happen. And actually, I promise you, it's going to happen less. So I hope you've enjoyed this course, and I will see you at another course soon.